I'm Gloria Ochoa-Bruck. I am one of the Spokane Municipal Court judges serving the city of Spokane. The type of cases that Spokane Municipal Court takes or presides over are generally DUIs and assault, force, domestic violence, malicious mischief, domestic violence. Those are the two, I'm going to say, more serious type of offenses that we handle. We also preside over cases that involve theft, vehicle prowl, criminal trespass, a variety of those type of offenses. So all of them are misdemeanors that are punishable with 364 days in jail and a $5,000 fine is the maximum jurisdiction that we have. One of the things that I have been observing over the years has been the shift in the type of substance use disorder issues that come before the court or individuals that come before the court. I've been practicing criminal justice since 2001 when I started out as a deputy prosecutor, and I also did criminal defense. And over the years I've had a lot of experience in the criminal justice field. But one of the things that has been very eye-opening in the last few years has been the sharp increase in seeing individuals that come through the court that the issue is for substance use disorder is fentanyl. And also we're also seeing a big sharp incline in how difficult it is for those individuals to engage in treatment. And the challenges that the court system has. Jail has never solved these type of issues, substance use disorder and mental health issues. However, when somebody gets charged with a crime and end up here in the criminal justice system, I believe it's an opportunity to have this be an intervention point. And that's where one of the areas that I'm interested in is how can we partner and collaborate with service providers in the area of when somebody is already here for whatever reason that they were booked and held in the jail, how can we use that opportunity as an intervention point to really deal with one of the most addictive substances that we've had in our communities, really ever in this country. I am also seeing that a lot of young people are coming through, and they do not look well. I've had parents come into the courtroom because they've been looking for their child downtown. I've had two parents came in, and their son had graduated from Meade High School. He came from a middle-class family, and they'd lost track of him, and he was severely addicted. They shared with the court how they'd been going downtown looking under tents and under blankets trying to find their son because they were so worried about him. And the son was in custody, and he clearly expressed that he just wanted to get released, and he had no intent of communicating with his family or getting treatment. And I think if he was in a different mind space, if he was in the middle of withdrawals, he would have an opportunity to really be clear-headed, to think about the family that loves him, the community that cares about him, and the opportunity to engage in treatment. One of the things that I have seen that is a cliff is when we are able to successfully get somebody to engage in an assessment while they're in custody, we release them into inpatient treatment. Those 28 to 30 days are just not enough with this type of, with fentanyl and how addictive it is, and not having a bridge of where they can go to for the outpatient component. And so we do see a lot of relapses. And so one of the things that I really hope is that there is some opportunities for when somebody is already in criminal justice involved, that we can use that as a positive opportunity to really help people get the services and the treatment that they need. One of the opportunities that exists is, again, when somebody is already criminal justice involved. So I'm not advocating that we arrest people for being homeless. What I'm saying is when somebody, for other reasons, excluding the fact that they're homeless or have a substance use disorder, end up criminal justice involved. The infrastructure of the court system with having probation and having a probation officer be able to work with an individual on ensuring they get the support and the referrals to treatment providers is important. But one of the things that happens is we can only do what we can do in our building. When there are individuals that don't have a support system or the capacity to execute on connecting with service providers or doing a lot of the prerequisite things, for example, if you need an ID card or somebody needs to get a copy of the birth certificate, things like that that may seem simple to some of us, or that we have people in our networks that can guide us and help us with that. One of the challenges that we also see is that we can direct people towards the services that they need, but not having somebody in their network or having the capacity to do it, we often see frustration and people just kind of fall off the cliff again. And so one of the things that I think there's a potential, hopefully opportunities, is there are different systems that are working with the same individuals. I know that we get here reports of people that went through the emergency room at Sacred Heart that are also criminal justice involved, or that the fire department through their program, have had to use Narcan, for example, to revive them, and they've been through the ER and they're also criminal justice involved. I think we're duplicating a lot of efforts with the same individuals, but not really collaborating on those intervention points when somebody ends up in the emergency room that is criminal justice involved, that has a warrant, or that ends up getting arrested for an offense. We do get a lot of assaults that unfortunately occur in the ER when someone is experiencing a crisis against healthcare providers, for example. There just seems to be a duplication of efforts and resources that I hope that there's an opportunity with this type of exposure to this issue in the community of how we can come together and work on making sure that we, when we work with the same individual, that we're not duplicating efforts and making it starting all over again every time that they either come here or the ER or the fire department if they are, have an interaction with them on starting over with data collection. Who are you? I know that there's been efforts towards that, but I see a lot of that, individuals that they're in custody and we release them to treatment, and then we set their case out for them to come back to court. And too often than not, we do get, the person doesn't show up or they abort treatment, but they don't have any, going back to that support system. One of the things that I think would be really helpful, and Compassion and Addiction Treatment Services has a group of peer navigators. If there would be a way to, going back to a collaborative network of service providers that are already doing this work, of having peer navigators assigned to individuals, and going back to when they're already here with the structure of probation, being able to do a warm handoff to someone that can, help that person navigate how to successfully access the services that are available. One of the areas that I'm going to say that I have a lot of compassion for is when I see really young people. I'm seeing a lot of younger people when their cases get called, and then I see that they're 18, 19 years old, and they've already lost their teeth, and they look really, really ill. They're emaciated and they're homeless. It's just heartbreaking that that's someone's child, that's someone's son or daughter. And while they're here already, what can we do to be able to connect them to services and get them that support that they need? There have been cases where, because of the drug-seeking behavior that unfortunately results in thefts and stealing from family members, alienating family, disappointing them. They've alienated themselves from their families. And when you see a young person like that, I'm going to tell you, it's difficult. It's frustrating when I don't have the resources to refer them to, because the court system, historically, the court system has kind of worked out here on its own. And so again, even though we're seeing the same individuals in other systems, we just tell you what to do, send you out the door, and then hopefully that individual will be able to access the services they need to rehabilitate. And I think that's a big missing hole, specifically with this type of the fentanyl addiction being so different than we've in our communities have ever experienced before. How highly addictive and also how lethal it is. We're also seeing, we get notices to the court when someone passes away. The cases get dismissed, and we're seeing young people that are overdosing on fentanyl. And I always wonder, could there have been an intervention point before that happened, where we could have perhaps intervened in a way that would have avoided that person having that demise of passing away so young. And this has been challenging in many areas, but one of the challenging things about criminal justice data in particular is that it exists in separate systems. Where even trying to do a public records request to get data is really difficult because of the way the data is stored. So, as an example, in municipal court, We have our own software system, it's called eCourt, but that's where we store our data, and then we do report some data out to the Administrative Office of the Courts, to AOC. Also, State Patrol has its own database, but the databases are separate, and they're collecting data that's very specific to the needs of, like the court, for example, or the needs of State Patrol, or the needs of like probation offices and Department of Corrections. They have their own data systems, but to try to generate a report of some sort, it has been challenging. One of the things that I did back in 2016 is I went back to earn my master's degree in criminal justice and criminology, which does a lot of, we learn about data and doing research. And that's one of the things that the criminal justice and criminology field spends a lot of time on, is how to get data, how to aggregate data, and kind of creating, pulling data from different systems and putting it together to create some sort of report. It's very challenging, very time consuming, so it makes it difficult for like a service provider, for example, or even for an individual agency without having a research professional on staff to be able to get that data from the different systems that needs to be pulled from to create meaningful, helpful reports. So that's definitely something that is a challenge. When kind of going back to, if there's a way to go back to collaborative approaches to things, I think that one of the things that I love about Spokane is I always say Spokane can, because Spokane has done some incredibly amazing things over the years by coming together as community. And I think this is a challenge that's definitely impacting our community in a very significant way. Very recently, the Spokane Regional Health District generated a report of the overdose deaths of fentanyl, and in Spokane County, we have the highest rate in the state, and our rates of fentanyl overdoses are higher than, they're increasing instead of going down. We're going the opposite as the state is. And so I think this is more of an imminent call to action, because this crisis isn't just impacting low-income, poor people. It's impacting all levels of socioeconomic, all levels of families in every community, in every neighborhood. I've spent a lot of time on my own time just really understanding what fentanyl is and how it works, and why we're seeing this, going back to like drugs of the past, like heroin and meth and cocaine and those kind of things, but why we're seeing such a difference in people overdosing on fentanyl, which is very, very different than what we've experienced in the past. And one of the things that I've learned has been that, one, it's very cheap to make, so it's very inexpensive. So if you do have an addiction problem, it's not like buying pure cocaine. It's going to cost you a lot more money than getting fentanyl. So the accessibility in terms of the cost is one. And then the other one is that it just takes such a tiny amount of the fentanyl to kill somebody, and people don't know what's in it. And you have like situations where you have like a batch that gets just distributed, and then everybody that takes that batch, because it has a lethal dose or amount of fentanyl in the product or in the drug, people don't know what they're taking, and it's frightening because people do not know what they're taking, and you're kind of playing roulette to see if that dose is going to kill you. I actually had a young man about 3 weeks ago that came through here, and he got released to inpatient when he was in custody, but he shared with the court that he had been revived 4 times with Narcan in one day. And I looked at him and I was like, you are so lucky that you happen to be around someone that had Narcan 4 times in one day. That is frightening. And he looked visibly shook by the fact that had happened to him. And so this thing is so different than we've experienced before. But going back to, I think if those of us that are in the system are seeing it happen, I think this is an important, I'm going to say, public issue that we all need to be aware of and see where we can step in and do our part. I guess what I want to also kind of to say is I know that there's a school of thought that the jail is a terrible thing, and I'm not advocating at any point that jail is a solution to anything. But given how deadly and how serious this fentanyl crisis is, when somebody, again, is criminal justice involved for other reasons, not because of their addiction or their mental health, but for other reasons, for having been either charged with a crime, or they've been convicted of a crime and they're on probation. I think there's a lot of opportunity that when we do have somebody that's here, that we find more ways to connect them to community and service providers, aside from us just referring you out and telling you to go show up to this place, because we lose a lot of people from the door when they get released, and as soon as we open the door, we lose a lot of them. I'm going to say the majority of them. So I guess what I would like to see, if there's any interest in the community about how can we connect people that are criminal justice involved, so that we can release them into the community with support, not just opening the door and having them fall through the cracks or go right back to exactly where they got picked up from. And in a lot of these cases recently with the spike in overdoses, not making it back.